Introduction. Trigeminal neuralgia is a debilitating neurological disorder characterized by severe, paroxysmal facial pain. The excruciating pain experienced by patients can significantly impact their quality of life. Understanding the underlying pathophysiology and the various management approaches are crucial for effective treatment. In this script, we will delve into the complexities of trigeminal neuralgia, including its etiology, clinical presentation, diagnostic techniques, current treatment options, and future directions. We will explore topics such as neurovascular conflict, secondary trigeminal neuralgia, pain processing pathways, advanced imaging techniques, pharmacogenomics, the association of trigeminal neuralgia with multiple sclerosis, neuroplasticity, psychiatric comorbidities, staged surgical approaches, invasive neurostimulation techniques, molecular targets for pharmacotherapy, and the psychosocial impact on patients. By the end of this script, you will have gained extensive knowledge about trigeminal neuralgia and its multidimensional aspects. Now, let us start our journey into the intricate world of trigeminal neuralgia. Trigeminal neuralgia is often associated with neurovascular conflict. This refers to the compression of the trigeminal nerve root by adjacent blood vessels, resulting in nerve irritation and subsequent pain. Several theories propose the mechanisms underlying this conflict, including arterial pulsation-induced microtrauma, focal demyelination, and triggered ectopic discharges. The most common vessel involved is the superior cerebellar artery, followed by the anterior inferior cerebellar artery. The compression may occur at various levels of the trigeminal nerve, including the root entry zone and the cisternal portion. Various imaging techniques, such as magnetic resonance imaging, MRI, and magnetic resonance angiography, MRA, aid in identifying and characterizing neurovascular conflict. Understanding the concept of neurovascular conflict is essential for targeted interventions, such as surgical decompression or neurostimulation techniques, which we will discuss in later topics. While the majority of trigeminal neuralgia cases are idiopathic or primary, a small percentage can be attributed to secondary causes. Secondary trigeminal neuralgia is associated with various pathological conditions, such as multiple sclerosis, cerebellopontine angle tumors, arteriovenous malformations, and skull-base trauma. Identifying the underlying cause is crucial for appropriate management. Multiple sclerosis is particularly noteworthy, as it often presents with trigeminal neuralgia as an early symptom. The demyelinating plaques seen in multiple sclerosis can directly affect the trigeminal nerve, leading to neuralgia. Other secondary causes involve compression of the trigeminal nerve by tumors or vascular anomalies. Management of secondary trigeminal neuralgia may require addressing the root cause along with symptomatic pain relief. Understanding the pain processing pathways involved in trigeminal neuralgia is crucial for targeted interventions. The trigeminal nerve carries sensory information from the face to the brainstem, where it undergoes complex processing. Peripheral nerve fibers transmit noxious stimuli to the trigeminal ganglion, which then projects to the spinal trigeminal nucleus and the ventral posteromedial thalamic nucleus. These nuclei relay the pain signals to higher centers, including the sensory cortex, limbic system, and descending modulatory pathways. Abnormalities in these pain processing pathways contribute to the development and maintenance of trigeminal neuralgia. Targeting key molecules and receptors involved in pain transmission and modulation holds promise for future therapeutic interventions. Accurate identification and quantification of neurovascular compression are crucial for appropriate management decisions in trigeminal neuralgia. Advanced imaging techniques have revolutionized the diagnosis and evaluation of neurovascular conflict. Magnetic resonance imaging, MRI, and magnetic resonance angiography, MRA, play a central role in visualizing the trigeminal nerve and adjacent blood vessels. High-resolution sequences and post-processing algorithms further enhance the detection of subtle compressions. Three-dimensional reconstructions and measurements allow for precise localization and quantification of the neurovascular conflict. Additional imaging modalities, such as computed tomography, CT, and digital subtraction angiography, DSA, may be utilized in specific cases. Importantly, the choice of imaging technique should be tailored to individual patient characteristics and clinical scenarios. Pharmacogenomics, the study of genetic variations influencing drug response, holds promise for personalized medicine in trigeminal neuralgia. Genetic polymorphisms in drug metabolizing enzymes, drug transporters, and targets may contribute to interindividual variations in treatment efficacy and adverse effects. Understanding these genetic factors can aid in predicting response to pharmacological interventions, optimizing drug selection and dosing, and minimizing adverse events. Genome-wide association studies and candidate gene analyses have identified several genetic variants associated with medication response in trigeminal neuralgia. Implementing pharmacogenomic principles in clinical practice may improve treatment outcomes and reduce the burden of side effects in patients. Multiple sclerosis, MS, is a chronic immune-mediated disease characterized by inflammation and demyelination in the central nervous system. Trigeminal neuralgia is one of the common presenting symptoms of MS, affecting approximately 5 to 10% of MS patients. The demyelinating plaques seen in MS can directly affect the trigeminal nerve roots, leading to the development of neuralgia. The management of trigeminal neuralgia in MS requires a multidisciplinary approach, considering the underlying disease process and potential interactions with MS-specific treatments. Surgical interventions, neurostimulation techniques, and medications targeting both pain and MS-associated inflammation may be employed. Early identification and timely treatment of trigeminal neuralgia in MS can significantly improve patient outcomes and quality of life. Neuroplasticity refers to the brain's ability to reorganize its structure and function in response to environmental stimuli or damage. It plays a significant role in the development and maintenance of chronic pain conditions, including trigeminal neuralgia. Maladaptive neuroplastic changes in the central nervous system contribute to the amplification and persistence of pain signals. Understanding the mechanisms underlying neuroplasticity and trigeminal neuralgia can provide insights into novel therapeutic approaches. Techniques targeting neuroplasticity, such as transcranial magnetic stimulation, repetitive peripheral magnetic stimulation, and cognitive behavioral therapy, show promise in modulating the pain experience and improving quality of life in patients with trigeminal neuralgia. Trigeminal neuralgia often coexists with psychiatric comorbidities, significantly impacting the overall well-being of affected individuals. Chronic pain conditions, including trigeminal neuralgia, are associated with an increased risk of developing psychiatric disorders such as depression, anxiety, and post-traumatic stress disorder, PTSD. The bidirectional relationship between pain and psychiatric conditions necessitates a holistic approach to management. Psychological interventions, such as cognitive behavioral therapy, mindfulness-based stress reduction, and pharmacotherapy targeting both pain and psychiatric symptoms, form an integral part of comprehensive treatment plans. Identifying and addressing psychiatric comorbidities alongside trigeminal neuralgia can lead to better pain control and improved quality of life for patients. For patients with refractory trigeminal neuralgia who do not respond to conservative management, surgical interventions offer a potential solution. A staged surgical approach involving multiple procedures can be utilized in selected cases to optimize pain relief and minimize adverse effects. The staging approach aims to relieve neurovascular compression, modulate pain signals, and preserve facial sensory function. The initial stage often involves microvascular decompression, MVD, or percutaneous procedures such as balloon compression or radiofrequency ablation. If the initial procedure fails to provide long-term relief, subsequent stages may include neuromodulation techniques like motor cortex stimulation or stereotactic radiosurgery. Tailoring the surgical approach to individual patient characteristics and preferences is crucial for achieving optimal outcomes. Invasive neurostimulation techniques, such as motor cortex stimulation, MCS, and deep brain stimulation, DBS, offer an alternative therapeutic option for refractory trigeminal neuralgia cases. MCS involves the placement of electrodes over the motor cortex, whereas DBS involves the implantation of electrodes in specific deep brain structures, such as the thalamus. These approaches modulate pain signals by delivering electrical impulses that interfere with pain transmission and processing. The selection of appropriate candidates for neurostimulation techniques requires careful evaluation and consideration of individual pain characteristics, response to previous treatments, and patient preferences. Adverse effects and long-term efficacy should be balanced with the potential benefits. Invasive neurostimulation techniques can provide significant pain relief and improve quality of life for patients with refractory trigeminal neuralgia. Advancing knowledge regarding the molecular underpinnings of trigeminal neuralgia offers promising avenues for future pharmacotherapy. Several molecular targets have been identified, including ion channels, neurotransmitter receptors, and inflammatory mediators involved in pain transmission and modulation. Understanding the intricate molecular pathways in trigeminal neuralgia can guide the development of novel therapeutic agents that specifically target these pathways. Genetic profiling, molecular imaging, and proteomic analyses hold potential for identifying personalized treatment approaches and predictive markers of treatment response. The advent of advanced molecular techniques paves the way for precision medicine in trigeminal neuralgia, bringing hope for more effective and tailored pharmacotherapeutic interventions. Trigeminal neuralgia exerts a profound psychosocial impact on affected individuals. The severe and unpredictable facial pain can result in functional limitations, social isolation, and emotional distress. Patients often experience anxiety, depression, sleep disturbances, and a reduced overall quality of life. The psychosocial impact can be further exacerbated by the challenges associated with diagnosis, treatment decisions, and the unpredictability of pain episodes. Hence, holistic management of trigeminal neuralgia should encompass not only medical interventions but also psychological support, patient education, support groups, and counseling. Addressing the psychosocial aspects of trigeminal neuralgia is crucial for optimizing patient outcomes and promoting overall well-being. Trigeminal neuralgia is a complex neurologic disorder associated with significant morbidity and impaired quality of life. Understanding the underlying neurovascular conflict, secondary causes, pain processing pathways, advanced imaging techniques, pharmacogenomics, association with multiple sclerosis, neuroplasticity, psychiatric comorbidities, surgical approaches, neurostimulation techniques, molecular targets, and psychosocial impact is vital for comprehensive management. The multimodal treatment strategies discussed in this script emphasize the importance of a multidisciplinary approach to address the multifaceted aspects of trigeminal neuralgia. By constantly advancing our understanding and refining our therapeutic approaches, we can strive towards better outcomes and improved quality of life for patients living with this debilitating condition.